In this lesson, you'll learn the basic steps to document on a new work-related injury. Click Start to continue. Your patient is a 45-year-old male who presents in clinic with a back injury. Your patient is here for treatment for the first time. You will learn how to review case instructions and complete the required forms to perform accurate and complete clinical documentation. To open Prognosis, simply double-click on the icon from your Windows desktop. From the Prognosis login, I will enter your username and password. Now, click Login to continue to your EMR homepage. Start the visit by selecting the new open case from the homepage. How do you know when there's a new injury case patient ready to be seen? The system provides 3 visual clues to help you identify a new injury visit on the homepage. First, the patient icon is red. This indicates health history information has been transcribed by staff and is ready for the provider to review and accept. Second, the reason for visit shows open case. The status shows for doc, which is short for ready for doc. It is important to note that provider time begins once you open or start the encounter. Now, click on the patient name to open the encounter. The system will open the encounter and automatically assign this visit to you. The first screen you see after you open Encounter is called Face Sheet Default. The face sheet consists of 3 pages labeled Face Sheet Default, Face Sheet 1, and Face Sheet 2. The face sheet displays different types of patient information in a multi-cell or grid format. For example, starting from the top left and going to the right, you see allergy, current medication, and occupational history. Before you begin documentation, always read the case instructions. Some of the grids are pre-populated with information obtained during registration and from patient health history, or PHH. The problem list, HPI, and treatment plan narrative grids are always empty on the first visit. After you complete your documentation, you should always return to the face sheet default view and take a quick look to verify that you've entered all the required information for proper documentation. You should always confirm that your name appears on the encounter before you begin charting. If for any reason, after you click on the patient name to open encounter, you notice your name does not appear or the system did not automatically assign you as provider, then you should click Encounter and select Edit Existing from the drop-down to add your name manually. Caution. Do not click Start New Encounter. Doing so will create a new encounter with no patient information. Now, click on Edit Existing. In our previous step, you reviewed the case instructions. Next, you must review and accept the patient health history. To view the patient health history, select Patient Forms from the table of contents. Click here. After looking at the case instructions, you must review and accept the patient health history. Add or edit information as needed. Be sure to complete the right side column for questions 10 and below. Once you are finished reviewing the patient health history, if you make any change, then you must click on Save to update the patient information. If no changes were made, then just click Accept to accept and confirm your provider review. Now, click Accept to continue. Now, click Accept to continue. Your provider review has now been accepted. Please note the green Saved Successful message at the top of your screen. Let's continue our visit by clicking on Doctor Forms and selecting the patient worksheet. Open the worksheet by selecting it from the drop-down list. In the worksheet, you'll review vital signs and other information provided by the patient and entered by the MA. In California, you can skip the emergent question. However, you must answer the medical history questions. Before answering the medical history questions, click on Physician Review highlighted in yellow. You must click on this button in order for the system to populate the HPI narrative into the gray text box, which is located at the bottom of this worksheet. Let's begin. Quickly review the patient vitals. Click on the PRB or Physician Review box. Emergent. If you are unsure that this applies for your state, please contact your regional medical leadership for clarification. Now we can begin to answer the medical questions. You must provide a description for any question that you answer positive. It is easier to click first, then go back and enter the descriptions last. Let's do that now. Select No to chemical or toxic exposure. Select Yes to any previous work injury or illness. Notice, a text box opened when you answered yes to this question. You must enter a description here. For now, let's leave it blank and continue answering the questions below. Select No to any pre-existing conditions. Select Yes to was there a specific event or an injury at work. Select Yes to was there a prior acute trauma to the affected body part. Select No to there's been an ongoing treatment for the prior trauma. Select No to any related hobbies or sports. Vitals Review. Check the Vitals Review box and select Well Appearing to indicate the patient's appearance. Now, we return to the questions and provide descriptions for each positive. I'll enter the descriptions for you. Remember, it's very important to note the body part involved and outcome for the prior injury question. We provided a description for the previous work injury. We can move to the next description concerning the specific event for this injury. This is where you tell the story. I will enter the description for you. Finally, we need to enter a description of the prior trauma. I will enter the description for you. Notice how the system created a neat HPI narrative at the bottom of the worksheet based on your assessment. The last step is to press Save. Wait for the system to display the Save Successful message in green letters at the top of the form. After you see this message, you can continue on to complete the body part form. Next, you will select the appropriate body part form so you can place orders for radiology and MA procedures. To begin, select the back form from the drop-down list. Placing orders first will speed the patient visit along and allow you to see more patients. To use the body part forms to document patient exam, complaints, and place orders for radiology and MA procedures, all of the body part forms have been arranged to look the same as much as possible. Let's place orders first. Click on the radiology MA order link and order X-rays and medication for this patient. Now that we've completed the necessary information to complete our first visit documentation, we are ready to update our workflow status and have our checkout person schedule a follow-up appointment. We will indicate the follow-up date that we want in the comments section. It's also important to use the following format to convey as much information as possible so that the checkout person can create a follow-up appointment correctly. Click on the patient workflow icon. Now, select the status Ready for Checkout. I will enter the comments for you now. Now, click OK.